The World Health Organization says about 120 million people are infected with a disease called lymphatic filariasis, commonly called Elephantiasis. The disease is prevalent in Africa and is transmitted by mosquitoes, according to health experts. Well, the news team finds out more on this worrying disease.
Lymphatic filariasis, popularly known as elephantiasis, is a painful and disfiguring disease that is characterized by the thickening of the skin. It is normally manifest in the legs and the male genitals. In some cases, the disease can cause other parts of the body, such as the scrotum and the breast, to swell. Health experts say the disease is the second most common parasitic disease after malaria. Lymphatic filariasis occurs when Anopheles or Mansonia mosquito with the parasites bites an individual. Approximately 30% of the infected population is found in Africa, including Ghana. In Ghana, surveys have shown that the disease is high in the Upper West, Upper East, Northern, Central and Greater Accra regions, with few infected districts in the Eastern and Bono-Ahafo regions. Infection is usually acquired in childhood, but the painful and disfiguring visible manifestations of the disease occur later in life. The damage affects the lymphatic system, kidneys, arms, legs or genitals.
When they suck the blood, there's a tendency that the blood is going to clot in their glands. But they also have some chemicals which they release into the person. So when they use their proboscis or whatever we call it, to prick the person, they release the chemicals into the person's blood before they suck it, so that it will prevent the blood from clotting, so that they can feed well on it. And in the process of injecting that chemical into the blood before they suck, they release the larvae forms of the parasite from their glands into the blood. Now, when they get into the blood, they move along the lymphatic channels, okay, to all parts of the body, then get to the lymphatic nodes. They get to them and then cross over to lymphatic system, or what we call the immune system. They spread over basically to all these areas, and then they can stay there depending on the type. Can be from a few weeks to even a year. Now when they get there, they grow, the larvae forms grow into adult worms, and these adult worms continue to migrate throughout the body in the lymphatic system, and as they grow and multiply, their population tends to block the lymph vessels.
The major symptom of the disease is a physical swelling of some parts of the body, but other symptoms also exist.
Another common sign is that you might find occult blood in your urine or milky blood. Now this results as a result of like the lymphatic vessels close to your abdomen would explode, and then the blood goes into your abdomen. So then when you pee, it comes out as bloody.
The body deformities lead to social stigma. This 25-year-old lady has lived with elephantiasis for years. She dropped out of school because she couldn't stand the mockery of friends.
No friend, everybody know me just because of the problem. Nobody wants to see me. I can't go to a place where people are gathered. They're all looking at me. Some people are mocking at me just of the problem.
This 28-year-old's dream was to become a footballer, but his dreams were dashed because of the disease. According to Dr. Ekwama Boatin of MAB Hospital, the worst symptoms of the disease generally appear in adult males than women. Some people believe that the disease is caused by spiritual forces.
There are no spiritual connotations to this disease. It's a disease. You know, it's a disease just like malaria or typhoid or anything. It's just another disease. But then because of, you know, the way the physical manifestation appears, you know, the large limbs and everything, so some people mistaking it for some punishment from gods or something. So that's why there's a need to educate people so they know that it is a disease, and for that matter, we have to do what we can to control it.
There is nothing hereditary about elephantiasis. We only know that there is geographical distribution, and even the treatment of elephantiasis depends on the geographic area that it is found.
We found out that there's a unique way of diagnosing elephantiasis by health personnel.
The microfilaria, they move up into the blood vessels. So when you take the blood, it is most likely that you are going to get it. That is the only way you can actually diagnose and see it. Either you find the adult worm in the blood, or you find the microfilaria in the blood. So if the test is going to be done in the daytime, then you have to give something we call provocative dosage of the drug to the patient. As the drug is being absorbed, it goes to make them very, very impatient and uncomfortable. And they are forced to move from the deep layers of the lymphatic vessels and come up into the blood vessel, and you are likely then to pick it during the daytime. Otherwise, the test is strictly done in the night.
Is the disease lymphatic filariasis curable?
There is treatment for it, especially if it is diagnosed early, okay? And there is even preventive drugs as well. We have a medicine called DEC, that's diethylcarbamazine, which is used basically in the States. But in Ghana and Africa, in fact, this disease actually is quite restricted to underdeveloped countries, especially in the tropics in Africa, okay? And if we diagnose it early, there are drugs that we use. In Ghana, for example, we use ivermectin and albendazole.
Okay, so if the disease is detected early, it can be treated with ivermectin or albendazole. But once the physical manifestation appears, the large limbs, no, that can't be treated.
Health experts advise that regular checkup, sleeping under insecticide-treated nets, and indoor residual spraying protects people in endemic regions from the infection. Dr. Ekwama Boatin says patients with chronic disabilities like elephantiasis, lymphedema, or hydrocele should maintain rigorous hygiene and take precautions to prevent secondary infection.
Beatrice Senadju has broken all the myths surrounding this disease, and she is here with me in the studio to talk about the story she worked on. Beatrice, you're welcome to the studio.
Thank you.
You know, the disease elephantiasis is quite rare. So how did you come by the story? Why did you decide to do such a report?
Okay, my editor gave me an assignment to enter in the assignment book as usual, as we normally do. And when she gave it to me, it was from the Noguchi Memorial Institute, and it was on elephantiasis. So she called me back and she was like, Beatrice, can't you do something out of this? So I took the challenge and I started the story, actually. So I was worried a little about how to get the shot.
Yeah, looking at your story, it was quite graphic. Your pictures were quite graphic. Was that when the difficulty set in?
Yeah, the difficulty started from the beginning. So I went to the Noguchi Memorial Institute and I met one Dr. Boache who helped me to get the shots, some of the shots, but it wasn't enough. So I have to fish out for the shots myself, and he also guided me as to where to go and who to talk to. Luckily for me, one day I was on my way to work when I saw this lady with a baby. They were all infected, and a gentleman who has been infected around Russia near Dansoman. So I alighted and I interacted with her, and I was having my camera, so I took some of the shots, and I came back to the office, and I picked my team.
Did she talk to you?
Yeah, I spoke to her.
But she didn't see the camera. You had no camera with you.
No,
so
I was having my personal camera, but I took the shots from a distance before I went to her to interact with her.
But did you ever thought of getting people to talk to when you were told to do such a report?
No, I never even dreamt of seeing them, because I can hardly see them on the streets in Accra here. And When I saw her and I came back to the office, I just called my crew and we went to Russia and we spoke to her. Actually, from the start, she didn't want to talk, you know, but as time went on, I was able to convince her to talk to me. And after that, like, she showed me a place where I can go. I went to La Paz, and my cameraman also made a lot of effort. Like, he also showed me places where he saw some of them.
They are hardly seen in town.
Yes,
there's this man at around Workers College, and that is where he's always been for the past, I think, 5 years.
You know, most of them have the disease, but coming out is a problem because they think people would not even like to talk to them.
Yeah,
and people think maybe it's spiritual, so they don't want to associate themselves with them, you understand? So it's a very bit uncomfortable for them to come out.
Okay. This man that I'm talking about, he begs for alms, and when he gets closer to you, you wouldn't like to look at him for the second time.
Yeah, you know, because of how the disease is, like when it starts swelling, like the way it will be dark, the way the color, the skin will be very, very dark, like that of an elephant, and it will swell, like, even like, I don't know how to put it, but it's very, very huge.
It's pathetic.
Yeah, very huge.
You know, breaking down to the layman's understanding, what exactly is lymphatic filariasis, elephantiasis?
Although it is a painful and disfiguring disease that is caused by the thickening of the skin, and it occurs when an Anopheles or Mansonian mosquito bites an individual, and by so doing they inject the parasite into the person's body or in the blood, and when it happens, that's when the body starts swelling. So that's elephantiasis.
But is it transmitted just like other infectious diseases?
No. You know, the Anopheles mosquitoes are the same mosquitoes which gives us malaria, and these mosquitoes get the infection from nematodes or roundworms. As we all know, they can live in one's body for years and produce millions of microfilaria that circulates in the blood. They move in the lymph nodes and multiply, so their population blocks the lymphatic system. They block all parts of the body, the blood vessels. They move across the immune system, and when this microfilaria block this system, they start swelling because there's no free flow of blood.
So it doesn't mean that when someone is around a person who has been infected, the person is likely to be infected by the disease?
No. It's not like that. The person would not be infected.
Okay. The major symptom of the disease is the physical swelling of some parts of the body. Apart from this, are there other symptoms?
Yeah, we have a lot of symptoms. We have signs, and sometimes you can have pains, bodily pains. You can feel feverish, and aside that, sometimes when they urinate, it turns into blood, and sometimes it's milky, and it's all due to infections. When the lymphatic system around the abdomen gets swollen, or when it's being infected by these nematodes, it gets swollen, and when it explodes, that's where when the person urinates, the person will see blood or milky substance as a urine.
No, since it's quite rare, how widespread is the disease in Ghana?
Actually, I was not told about the exact percentage of the infection in Ghana, but I was told that the disease is very high in the Upper West, Upper East, Central, Northern, and the Greater, with few affected districts in the Eastern and the Brona-Hafo regions.
But which kind of people are really infected? Is it children or grown-ups?
According to the doctor I interviewed, he told me that it's in men more than in women. And sometimes too, you don't see it in children because when you get the disease from infancy, it will not show any signs until you grow up, until you are of age, maybe, let's say 15 years later, 8 years, 6 years, 7 years later. That's when the physical manifestation sets in. So you not see it in children as you see it in adults.
I'm a little bit hesitant to ask you this question, but is there any linkage between elephantiasis and spiritual forces?
No. There's nothing like spiritual connotation related to this disease. It's being transmitted by mosquitoes. But, you know, I spoke to a lady off camera, and the lady told me that her husband picked or took their children away when the husband got to know that she has been infected with the disease. And you know how women are so emotional about their children.
He sacked her from the house.
The man moved out of the house and left the woman there.
With the children?
No. He picked the children away.
And left the woman all alone?
All alone. And you can see how the emotional the woman will be. The woman cried all day. And there was this lady I interviewed in my story, and she dropped out of school because she couldn't stand the mockery and the rejection of family friends and everybody.
I think it's a big challenge for people living with this kind of disease.
Because nobody wants to even get close to them. The lady was telling me that like she was not having money to buy food.
How does she fend for herself?
Yeah. There's no money. Like nobody wants to talk to her. She was not like when she goes to ask for unemployment, she's not being able to get the job, all because of the disease. And like I was soaked in tears. Like I didn't know what to do at that point in time. It's not like when you get to the person you get the disease. It's not like that. The disease is being transmitted by mosquitoes, and that's it. There's no spiritual connotation related to this issue.
Okay. Is it curable?
Yeah, it is when it's being detected early. But when it's not and the physical manifestation setting, the swelling setting, there's nothing that can be done about it.
No surgery?
No, unless sometimes amputation may set in. That's the only remedy when the infected parts get swollen.
To summarize it all, what can you and I do to reduce our chances of contracting the disease?
Okay, the doctor said that regular checkup is important, and he recommended that we should sleep under insecticide-treated nets. It's also recommended. That's what we can do to not to contract the disease. But he also said that we should maintain hygiene and make sure that our surroundings are clean.
Thank you very much, Beatrice, for sharing with us this information.